Hi everybody, I'm Daniel from Dr. Chrono. So what Dr. Chrono is, we're essentially a mobile app for doctors. So doctors, we really focus on electronic medical records, revenue cycle management, and practice management for physicians. We really focus on this, and this is our angle in healthcare, where doctors can pretty much be anywhere. I'm going to go over 3 things during my talk. First thing I'm going to do is I'm going to talk about the history of Dr. Chrono. The second thing I'm going to talk about is a few case studies of actual doctors using Dr. Chrono. And then I'm going to go into a live demo so you guys can see the product. I'll try to show a quick demo. So going into the history, it's easier like this. Yeah. So the history actually of the company, we started the company in 2009. It was me and my co-founder, Michael. And the company has grown to over close to 40 people at this point. And essentially what we thought about when we first started the company was we were in New York City and I was going to see doctors, and the doctor gave me a paper clipboard, and then he took the paper clipboard and wrote on it himself. I'd go home and I didn't even know what happened literally during these encounters, right? What did they do to me? What was I being billed for? These kind of things. So this was really one of the questions I had was, healthcare was kind of messy for me. And then looking at my co-founder, before we even started the company, his father was seeing multiple doctors in really prestigious hospitals. And they had these things called cows, which are basically computer on wheels, right? You'd wheel this thing around, you guys would see these in the hospital. And they were they were very not interactive. So the doctor would kind of turn his back to you for about 20 minutes and you just kind of feel like, what are they doing? And really, my co-founder, he found it to be a really frustrating experience because he'd see several doctors with his father, and his father was taking 20 medications, and you guys see where I'm going with that, where his father didn't even remember the medications he was on half the time. So, and everything was driven by paper. A lot of it was driven by paper when they'd go between hospitals. So we got together and we realized healthcare was very broken. And we sort of thought about everything and started to think about the cloud. Now this is 2009. There wasn't really a tablet revolution at that point, right? So we were thinking, well, we could sort of build something for the web, and we started a rapid prototype. And for the first year of the company, we really just shadowed doctors. We were looking at doctors thinking, okay, what do they need? What do they want? And we saw all of these doctors faxing and basically pushing paper all over the place. We both had iPhones. And we realized, well, this device is really cool. There was no iPad at the time, right? And we're looking at the iPhone saying the screen real estate is kind of small, and you can't really fit too much data on there. So we kind of held off on building on the iPhone, and we were building more for the web. Then roughly around April 2010, well, even before then, around January, Apple mentioned that they were releasing the iPad. And we downloaded the software to build on the iPad before the actual hardware came out. And we started building out this app, and we realized, wow, this screen is way bigger. You can fit a lot of data on here for a doctor. There's a lot of things that are going on in the doctor's office, so they want to see a lot. And we built out this version thinking, well, let's just test it out, right? We released it week 1 when the iPad came out. Our app shot to the top of the medical apps, and then we had droves of doctors actually contacting us. And we realized, okay, this is an interesting market. Medical iPad apps. And this is really like the beginning of our company sort of shooting up at a drastic rate. We really thought about simple design. So when we were looking at the iPad, we said, well, this is mainly a consumption device, right? So how do you allow doctors to enter data at a really rapid rate when they're seeing, say, 40 patients in a day or 30 patients in a day? So we had a lot of multi-selects. We built something called macro buttons, which is like a special type of button. We integrated medical speech to text. We built out a templating system so doctors can just do multi-selects and drop-downs. I'll demo a bunch of this so you guys can see it. And we wanted a simple workflow. So the simple workflow would be, I as the patient would be home, I'd be on my iPhone, enter a bunch of data, or I'd be on my laptop, enter a bunch of data, walk into the doctor's office, the staff member would hand me an iPad, I enter a bunch of data on the iPad or just review it, hand that back to the staff member just reviews everything, does a real-time eligibility check, a bunch of things, checks the doctor calls me into the back, then the doctor starts to see me at the point of care. And they're using an iPad also. So our vision of what healthcare really is, and this is really where it's going, is everything is going to be very tablet-based. And really kind of, it'll sort of simplify things. So the doctor sees me, I go home, and I can get access to my lab results now. I get access to what they were billing me for. I get access to, say something is wrong, the doctor can actually give me that data, right? Which is really great. That's what I want. And that's really what sort of drove us to start the company. You guys probably have seen this. This is a graph showing 2009, there weren't really that many internet users on mobile. Now, in 2013, there's going to be more mobile internet users than desktop users. So this is sort of validation for where our company is going. Also, this is another interesting graph. If you see the blue part is essentially mobile subscriptions. So mobile subscriptions are shooting through the roof right here. And then there's going to be 2 devices per person in the year 2015. So every person in this room is going to have 2 tablet devices roughly by the year 2015. Now our company, we really focused on a different type of model. We tried a few things out, and this seemed like the one that seemed most progressive to us. We wanted a freemium service, something like Evernote or Box or Yammer. So we basically have a free model with paid plans on top of that. So a doctor can try our software out, ask for help, use it for free, and then they can upgrade into like the more savvy advanced features over time. So it's very much like a Gmail, where even Gmail, if you hit your 7 GB limit, they actually make you pay at that point. Most people don't hit that limit. When looking at the market, our company realized, how do we get users to use this? So we did a grassroots. We focus on grassroots, which is go after the single practicing providers and the smaller practicing providers. Going after hospitals, it's a large turnaround. So we figured, let's get the smaller providers and move upward. There's also something, the government stimulus. So this is basically incentive from the government for doctors to digitize medical records. If a doctor downloads our app for free, they get paid. Literally, the government will pay them for using our medical record app. I'll go into like one study here where you can see a doctor who downloaded the free app and literally got a check for thousands of dollars. So I did a little research before this talk. 62% of physicians are using tablets in the US. 27% of doctors are using iPads, and this is growing. So this is massive. Really interesting. Okay, so I'm going to go into a few case studies now, so you guys can see just a few of these are real-life users. So this is Dr. Sani. He's a gastroenterologist. He is using Dr. Chrono in Newport Beach, California. We met him at an Apple. We do a few Apple events where we demo our product to Apple doctors and Apple stores. And he came into an Apple store and said he was using us. Came up to me, and we had a good dialogue about how he was using Dr. Chrono. And essentially what he's using it for, he really wanted medical speech to text. He didn't want to type on the iPad. So because we had that, he was able to talk directly into the iPad, saying things like laceration of the left leg. Really interesting things, and literally talking into the iPad. He loved Apple. He was an Apple fanboy, so he essentially jumped onto the bandwagon very early on in what we were doing. Another doctor is Timothy Rockrest. He's a psychiatrist out of Bangor, Maine. And he was a real good example of what we were looking for in a doctor when we started Dr. Chrono. He was looking for something free. He didn't have a lot of money. He was starting his own practice, and he wanted to get the meaningful use incentive dollars that the government was giving to people to digitize their medical records. So we fit what he was looking for. He started using us. We had, since we had this mobile focus, he basically works in nursing homes and group homes, so he goes from different location to different location, and he really needed something mobile. He didn't want a desktop. He wanted to move from location to location, so we sort of fit that also. He wanted that type of mobility. But you can see here, he was a free user, right? A free user using Dr. Chrono for about a year. Then he got his meaningful use incentive dollars. So he got several $1,000s for using a free app on the iPad. He decided, well, I got all of this money and this is bringing me value. Why don't I pay for this software? So he started paying after a year. And then it was really great because he called us, I'd say a year and a half after, and he said, well, I'm moving into a larger practice and I've convinced all the doctors to use Dr. Chrono. So he basically got 7 paid doctors at that point using our software. So that's like the natural progression of what we were looking for. Really mobile, focused, disruptive type of, that's the thing that we're going for. Another doctor is William Wall. He's in San Jose, pretty close to here. He's an orthopedic surgeon. He really wanted to take his paper forms and just put them on the iPad. So he was looking just to literally just put his forms on the iPad and interact with his patients in a better way. So we have a few screenshots of him with a patient where he's interacting with the patient right here. And if anybody wants a doctor near here, he's using us. So here's another doctor, Dr. Dick Tabin. He's a plastic surgeon in New York. And he wanted Dr. Chrono simply because he wanted something on the cloud. He wanted to be mobile. He kind of wanted that new state-of-art thing. He wanted to get off paper. And because he is a plastic surgeon, he wanted to draw a lot on the iPad and show like really nice images. So say that there was a manipulation, he could draw on the iPad and show that to the patient while they were right there. Here's some of our doctor growth. So we currently have 38,000 physician signups and growing at a rapid rate simply because of the mobile is pushing us, the government is pushing us. There's a lot of things pushing the company in a forward direction. Now, the software is not just for doctors, it's also for patients, right? We're all patients, and really, me and my co-founder, that was really why we started the company initially. So we got a foothold in the doctors, and now we're starting to branch out way more into the patient side. So I actually think we're the first medical company to build Passbook onto the iPhone. So you can use a 2D barcode in Passbook as a patient and show that to a doctor. They can take a picture with that free app, the doctor app, and after a verification, the doctor can literally get a copy of your medical record. Now this is game changing because think about this. Say you're on your vacation in Europe and you hurt yourself, you break your leg, right? You can show that to the doctor. The doctor can take a picture with the Dr. Chrono app and say, okay, I have a copy of your lab results. I have a copy of what you're allergic to. I have a copy of what drugs you're currently on. And suddenly there's less confusion for you as the patient, right? So we're looking to sort of disrupt it in a way where you can carry your iPhone, you can carry all your music, your banking information, and now your medical record. So now it's sort of a way for you to just kind of bring your medical record anywhere you go. It has other things like messaging. This is the messaging right here. Okay, so right now, currently we're hitting almost 2 million patients using the software as well. So we have if you guys wanted to download the app, it's called OnPatient. It's the patient-facing version of Dr. Chrono. Okay, so I'll give you guys a quick demo of some of the software so you guys can just see how it works. So what I'm going to show you first is something called OnPatient in the check-in in the waiting room. So when you walk into the doctor's office, they don't have to use this, but they can if they want. So a lot of the software we give is optional. So they can use this check-in app, hand you an iPad, and then essentially you could fill in all of your information. So I'm just going to sign in as a staff member. So staff members see this right here. They see this list of people, right? And they say, okay, who's coming in today? And they can kind of go through this list and just look around and say, okay, so say Jenny Harris is coming in. I'm going to start onboarding Jenny Harris. And this is basically the point at which the staff member hands the iPad to Jenny. So I'm going to hit start. Now once they hand the iPad to Jenny, Jenny can review all of her information here. So she can scroll through everything. She can edit things one by one if she wants, so you can kind of do this if you want. Or you can have this high-level view right here. So you can look at your allergies, your medications, and everything. And one thing that I like is the questions, right? Before you go into the doctor, you generally have some questions. So in the waiting room, you can hit edit and put a question in there like, Let me try one out. I have back pain. So, I mean, I just used Siri on the iPad, and you could see Siri actually, I didn't even have to type anything, which is way cool. So as a patient, you can also sign off on consent forms here. So I'm just going to read the consent form quickly so you guys can see this. Read the consent form. What most people do. Sign off on that, right? There you go. Finish. OK, so now the signature is on file as well. So the patient is signed for HIPAA and whatever else they need. So I'm going to hit finish onboarding. So once the patient is done, now the staff member takes the iPad back, and now everything is already in Dr. Chrono. So the staff member has it, the doctor has it. So now I'm going to move on to the next app, which is the Dr. Chrono electronic health record app. And this is another app for doctors, so I'm going to launch this one. So this one is what the doctors use at the point of care. So when you walk into the back, doctors use this app right here. So the interface here in the beginning looks very similar, but everything other than that is very different. So here's Jenny Harris again, so we'll still use her for this demo. This is basically the list of patients coming in for the day. And there's a lot of things you can do here, like you can do a real-time eligibility check, which means you can check their insurance to see if it's valid. And so I'm just going to dive in right here to patient chart, so you guys can see a little bit more. So the doctor can basically review the history, right? So Jenny's here because of her pregnancy. HIPAA form signed, okay. Ultrasound, let's take a look at that. Some really cool things, the interactive part of an iPad. You can do something called free draw. So I'll just free draw on this so you guys can see that quickly. So this is the head of the baby. This is like the body area. You can do typing, so, let's see. This looks good, right? There you go. Hit save. Save as new. So that's being uploaded to Dr. Chrono. Finished. There's other things like videos, so I'll just show you a quick video. See if this loads up. Oops. Sorry about that. Here's a video. So doctors basically can have a multimedia medical record, and they could show this to their patients. This is really valuable. And then the patient can also get this data the patient side of things. So I'm just going to go back here now to visit. So this is something that actually really sells the product. These custom templates, to you guys, this is really valuable to doctors. They can customize this to any way that they want. When we show this to doctors, this is what really sells them on our product. They want their paper forms on the iPad. So they literally have stacks of paper forms, and they say, how do I put these on the iPad? We have a builder, and they can just drag and drop, and then it builds out these forms. Our team does do it for doctors, but that's a paid service. So I'll just show you really quickly fast input. So multi-select, select this right here, select that. You guys get the idea. There's also something called macros. So you could say patient name, right? It auto-inserts stuff. So normal exam. So they could build out these macro buttons. This literally manipulates the keyboard so they can have other types of input, so they don't have to type much. And we also have medical speech to text. So let me just show you guys that. So medical speech to text is a little bit different than Siri. Chief complaint, patient has runny nose. It's a little loud. I don't know if that, chief complaint, patient has runny nose at. Not bad, it's not bad. But you get the idea here. I guess I'll show one last thing. I think I'm running out of time. I'll just show you guys refills or new prescription drugs. Really robust system, really simple. The doctor doesn't really have to do much. Literally, they could send the prescription to the pharmacy that the patient had requested prior. I had set that information up before. So sending prescription, it sends the prescription, and then it's done. So that's a little bit of Dr. Chrono. Thank you, guys.
Thank you, Daniel. Just a quick question, raise of hands. How many people here have been to the doctor recently and had that doctor have a tablet in their hand while they're performing their examination or diagnosis, or the nurse or some other healthcare professional? That's not as many as I thought. And this actually raises a good question, Daniel, in terms of BYOD is good for some verticals. For doctors, though, is this something that you're seeing as a trend within the healthcare field?
Definitely. I would say close to 2/3 of doctors have iPads now in medical settings, but not all doctors have it at this point. Mm-hmm. But it's definitely, the rate of adoption is going up drastically. And I see we deal with smaller practices, so the doctor's the decision maker. They want to watch Netflix and do medical records at the same time, right? So it is their practice, they're running it.
Right, but they're watching Netflix as I'm paying them. Okay, good. All right, Daniel, thank you so much.
Thank you, guys.